John King, certainly a star of Sunday morning talk. Move over this Sunday, though. President Obama is going to be the real star of Sunday morning talk shows because he's booked on 5 networks, folks. That's the most ever aired of a sitting president in a single day. Monday, then, he becomes the first president to appear on The Late Show with David Letterman. He appeared on that show as a candidate, but this time around, the questions will be a lot different. Well, can the same be said for the president's message as well? Kenneth Thorpe, considered by many one of the leading healthcare experts out there in the country, a trained economist here, but certainly helping Democrats and Republicans up on the Hill as they try to put together some of this legislation. Good to have you back with us. Last time you were here, you said we were closer than we'd ever been before because back when President Clinton was trying to put health care together, never got a bill out of anywhere. We have several bills now, and we have another bill, the Baucus Bill. You still think we are closer than ever before, and how much closer are we than the last time you came and talked to us?
Well, we're even closer because I think the main vehicle to push reform through is going to come through the Senate Finance Committee. That was introduced this week. Amendments went through yesterday. Next week, the committee will start marking it up, meaning working on the actual legislation. So I think everybody remains hopeful. Everybody's still at the table working at this, and I think as it goes through the process, there'll be more and more support for it. And
you have been helping with this, and the one thing here that everybody gets hung up on, it came in, the CBO, I believe, said $774 billion. The Baucus, the committee said it cost about $856 billion. All right, but still some saying it's going to go up once everybody gets their hands on it. Would you say that's going to be the case?
Well, I mean, the Senator Baucus is trying to strike a middle ground here, sort of the Goldilocks strategy. Right. It's a little bit too warm, a little bit too cold. Right. I think he's trying to get it right in the middle. And there's going to be pulling and pushing on both sides of this. My sense is there'll probably be a little bit more money put in to make sure that the middle class, when they buy insurance, that it really is affordable. But at the end of the day, it's still going to be substantially below that $1 trillion figure that we've heard and seen before.
You would say substantially. A lot of people are saying to cover more of those middle class families, and this has been, even on both sides, we've heard this argument, not enough of the middle class is taken care of, and they're going to be able to afford this health care. And to get some more of those subsidies in there, to get more of that help for middle class, you're going to have to substantially increase the cost of this bill.
Well, that's going to be the trade-off. I think to move more of the middle class to make it affordable, you're going to have to put more money in. On the other hand, there are a lot of people concerned about the price tag as it stands. Yeah. So balancing that is going to be Senator Baucus's main challenge next week.
And I think we have a graphic here to show. We talk about families and middle-class families and just what they're having to pay these days. We have a graphic that shows a family, the coverage has been up 5% in 2009, and we see there what the employee and what employers are paying in the total. I mean, just it keeps going up. Are we going to? I mean, given what we have seen in some of these bills, will they cause that number to start going down anytime soon? Give people out there listening to this, is this really going to help me out and stop these costs from going up?
I think compared to doing nothing, there's no question that this is a dramatic improvement over the status quo. Let me just take a small business owner or somebody self-employed. Today, you can have a 20, 30, 40% increase in your premiums year to year. You never know how much those premiums are going to increase. If you're a small business owner under this proposal, the premiums are going to grow up slower, and there's going to be much more predictability in those premiums. That's one of the main issues that small business owners have, is that there's no predictability year to year. So I think if you're a small business, self-employed, you're going to see a dramatic improvement in what you pay for health care in this proposal.
Okay, last thing here, and you can't have a health care conversation these days without mentioning the public option. Baucus bill does not have it. In there. Some in the House have said it's dead on arrival if it shows up without a public option. Will that continue to be a fight? And I guess how much are we going to see added to a bill if it did have a public option?
Well, I think we have to go back to the basics here. You know, if you go back last year during the campaign, then candidate Obama talked about 2 goals. One was to control the growth in health care spending, which I think this proposal does. And 2 is a move to universal coverage. Those were the overarching goals. The public option was a tactic or strategy to help achieve those goals. But I think at the end of the day, we're going to have to make some trade-offs about what's the real goal here. Is the public option going to drive the debate? Or ultimately, are we going to get universal coverage and cost control? And that's going to be the centerpiece of this debate going forward.
Well, right now, you might have made a good point there. It seems like the public option has been that centerpiece of the debate and a hot potato people throwing back and forth. We will see what happens. Kenneth Thorpe, so good to have you here in town, over at Emory. You're here in our neck of the woods, and we told you we'd have you back in here, and we'll have you back again. Thanks so much.
Okay, terrific. Thanks for having me.
All right, Betty.
That was great information. And